Hi, let me introduce myself as TERBUTALINE. My generic name is originally TERBUTALINE, and my brand names are Bricanil and Brithin. And this is my chemical name. My therapeutic drug classification is bronchodilator, and my pharmacologic drug classification is beta-2 adrenergic agonist. And I belong to pregnancy category B. My chemical effect is that I relaxes bronchial smooth muscles by acting on beta-2 adrenergic receptors. And my therapeutic effect is to improve breathing ability.
For pharmacokinetics, I am absorbed about 33% to 50% through oral dose, and unknown for subcutaneous route. I am widely distributed throughout the body, partially metabolized in the liver to inactive compounds, and excreted primarily in urine. My onset for per orum route is 30 minutes. The peak is 2 to 3 hours, and the duration is 4 to 8 hours. For subcutaneous, greater than or equal to 15 minutes, the peak is 30 to 60 minutes, and the duration is 1.5 hour to 4 hours.
My indications are bronchospasm in patients with obstructive airway disease, for adults and children older than the age of 15, initially 2.5 mg per rm 3 times or 4 times a day. Increase to 5 mg per rm 3 times a day at 6 hours interval while awake. Maximum of 15 mg daily or 0.25 mg subcutaneously. May repeat in 15 to 30 minutes. Maximum of 0.5 mg every 4 hours. For ages 12 to 15, 2.5 mg per rm 3 times a day. Maximum of 7.5 mg daily. And also for premature labor, initially 2.5 to 10 mcg per minute IV or intravenous. Increased dosage gradually as tolerated in 10 to 20 minutes intervals until desired effect are achieved. Maximum dosage ranges from 17.5 to 30 mcg per minute. Although dosages up to 80 mcg per minute have been used cautiously. Continue infusion for at least 12 hours until uterine contractions stop. Maintenance therapy is 2.5 to 10 mg per rm every 4 to 6 hours.
Contraindications. I am contraindicated in patient who is hypertensive to me or any of my components or to symptomatic amines. And you should use me cautiously in patient with cardiovascular disorder, hyperthyroidism, diabetes, or seizure disorders. And you should also use me cautiously in pregnant women or to those who is breastfeeding, because it's unknown if I appears in breast milk, and in children aged 11 and younger, safety and effectiveness haven't been established. My adverse and side effects are, for the CNS, dizziness, drowsiness, headache, nervousness, tremor, and weakness. For cardiovascular, arrhythmias, chest discomfort, flashing, hypertension, palpitations, and tachycardia. For ears, eyes, nose, and throat is tinnitus. For GI, heartburn, nausea, and vomiting. For metabolic, hypokalemia. For respiratory, dyspnea, paradoxical bronchospasm. And for the skin is diaphoresis.
For the nursing responsibilities, so for the assessment, assess patient's condition before starting the therapy and regularly thereafter to monitor drugs effectiveness. Also, monitor patient closely for toxicity. And lastly, assess patients' and families' knowledge about drug therapy. So for nursing diagnosis, it can be ineffective breathing pattern related to underlying respiratory condition. Also, acute pain related to drug-induced headache. And lastly, deficient knowledge related to drug therapy. For the planning and implementation, for subcutaneous administration, inject in lateral deltoid area. Next is if bronchospasm develops during therapy, notify the prescriber immediately. And lastly, mild analgesic may be used to treat drug-induced headache. And for the patient teaching, explain to patient and family why the drug is needed. Next is to instruct the patient to report paradoxical bronchospasm and tell him to stop the drug if it happens. And lastly, warn the patient that tolerance may be developed with prolonged use. That's all for my autobiography. Thank you for watching.